Hello and welcome to the YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. In today's video, I'm going to talk to the people who are suffering from facial palsy. Yes, it's been a long while. I have not made video related to facial paralysis or else Bell's palsy. So I thought, why not to come up with a video where I can answer all of the questions that you have asked me in the comment section below. So let's begin. So friends, in today's video, I would be answering some of the commonly asked questions related to facial paralysis. So make sure to watch this video till the end. And let's begin with the first question, and that is, what is Bell's palsy? So what is Bell's palsy? Well, Bell's palsy is a type of facial palsy which could either happen due to a viral infection in the middle ear, or else sometimes Bell's palsy happens due to unknown cause, but mostly in Bell's palsy there is paralysis of one side of the face, complete one side of the face. The features could be drooping of mouth, the difficulty in closing the eyes, loss of facial expressions. But this is a temporary kind of paralysis which gradually returns back to the normal. Next question. How different is Bell's palsy from other facial paralysis? This is a very important question. Many people think that if they have got facial palsy, that means they have got Bell's palsy. This is not necessary. Facial palsy happens due to three major reasons. One, as I mentioned, is the Bell's palsy, which is a temporary paralysis of your face. Apart from that, facial paralysis can happen due to injury to the brain following a road traffic accident, or else even if you have got some kind of tumor inside the brain and you go for a surgery, while removing that tumor you can get facial paralysis. And even in sometimes when the tumor is increasing in the size, this compresses the facial nerve and can cause to facial paralysis. That's the second common reason. And the third kind of facial paralysis happens due to stroke or else a paralysis attack that happens in the elderly age group of people. So broadly speaking, there are three major reasons of facial palsy. Yes, there are other conditions as well in which facial paralysis happens, but those conditions are mostly rare. Third question. What causes Bell's palsy? So as I mentioned in my first answer itself, Bell's palsy can either happen due to idiopathic cause, which means no known cause. Many people will have Bell's palsy episode without the history of an ear infection or else ear pain or any kind of viral infection. But mostly the Bell's palsy happens due to infection in the middle ear caused by herpes simplex virus. But having said that, it's not necessary that every Bell's palsy will be due to infection of herpes simplex virus, but just it is one of the common reasons. So the next question is, what if one does not recover from Bell's palsy? Well, this happens very rarely. Most of the Bell's palsy cases recover completely within 3 months of time frame. But if the damage to the nerve has happened more, it might take little longer, say around 6 months and even sometimes 1 year. Now, apart from that, if a patient has got some sort of incomplete recovery, that means the nerve has been majorly damaged. Next question. How physiotherapy can help in management of Bell's palsy? So, physiotherapy basically helps by rehabilitation. So when a nerve damage happens, the nerve basically forgets how it has to function, and that's why the muscles of the face which are affected or else are controlled by the facial nerve also forget its function. So the role of physiotherapy is in re-educating these muscles to return back to normal. So physiotherapy basically comprises of use of electrical stimulation therapy, that is also only when there is complete paralysis of the face, otherwise it is not required. Rest of the time it's mostly facial massage, facial stretching and facial exercises. What are the foods to eat and foods to avoid during Bell's palsy? Now, well, I have created an entire video about it, but in general there is no direct food recommendation that is related to facial palsy. Having said that, since it's a paralysis of the face, the patients will have difficulty in swallowing, chewing. That's why semi-solid food that helps in recovery, so which is rich in antioxidant, is more preferred. and food that is fried and has got high amount of trans fat, these kind of foods has to be avoided. Now, what are the precautions one need to take while recovering from Bell's palsy? This is a very important and very good question. Yes, you should take some precautions while you are recovering from Bell's palsy. These precautions are, the first and the most important one is protecting your eye. If your eye is not completely getting closed, it is more at higher risk of catching infection and getting dried. Hence, you need to protect your eye often by either eye taping or else eye patching. Apart from that, the second precaution that you need to take is don't overdo exercises. Mostly the people make mistake while recovering from Bell's palsy. They try to put more effort and try to do more and more of exercises. This is not advisable. Instead, you should do opposite of it. You should allow the nerve to recover on its own. Do minimal amount of exercise with focus on the technique, not on the repetitions, and be very gentle on it. So that is the most important precaution that you should take while recovering from facial palsy or else Bell's palsy. What are the common difficulties in Bell's palsy treatment? Yes, again, there are few difficulties that will come in Bell's palsy treatment, and the first and the most important one is taking time. So the treatment time for Bell's palsy is long, since this condition itself takes its own time to recover. So you cannot expect that you would be absolutely fine in 1 week or 2 weeks. Yes, if you are lucky enough, it might happen, but I would highly recommend that don't go with that expectations. Gives yourself some time to recover on its own. Second difficulty comes is the lack of good well-being. So if you are stressed, if you are getting fever and other infections, that is common cold, so stuff like that, then that might impact your recovery in Bell's palsy. Hence, the focus should be in maintaining a good well-being while you are recovering from Bell's palsy. Next question, what is synkinesis and how it is managed? So synkinesis is nothing but a complication of facial palsy where the nerve gets miswired and start supplying to the muscles which are not actually supposed to work under that. What do I mean by that? Which means whenever you are having synkinesis, you will have some involuntary movements on your face just because the nerve has healed, but has healed in different or else wrong direction. That means it is supplying to some of the wrong muscles which it is not supposed to supply. Coming to the management of synkinesis management basically focuses more towards relaxation than towards movement. More towards the technique of movement over towards the repetition of movement. Therapy is basically very targeted towards teaching the patient to do the right movement pattern while inhibiting the wrong movement patterns. It needs a very precise, concrete time that you need to spend with your therapist while practicing your movements. So the next question and the last question, and how is the prognosis of synkinesis? Which means, is synkinesis treatable or not? Yes, synkinesis is absolutely treatable. You can come out of the synkinesis, but it takes time. Second, you might expect some level of residual impact that is still being there despite taking the treatment. And third thing, synkinesis might not completely recover just with the help of one therapy. You might need to take combination of surgery or some medical management plus physiotherapy management in order to get better result, all depending on what level of synkinesis is there. But one of the most important thing is synkinesis is preventable. Hence, if you are having facial paralysis or else in Bell's palsy, make sure to start your treatment as early as possible. Don't wait for all the symptoms to come and then start the treatment. Make sure to see your physiotherapist, ask what you are supposed to do, what you are not supposed to do, and then only start your treatment. So friends, these were some of the frequently or as commonly asked questions related to Bell's palsy and facial palsy. I hope I was able to answer some of your questions. If you still have got any questions and if you like to consult with me, make sure to send an email on meghana@medohealthconnect.com. The email link is mentioned in the description below. You can book or schedule a video consultation with me. We can have a proper interaction regarding your Bell's palsy or else facial palsy, and I will try to help you out in managing it through the help of physiotherapy. On that note, I will end this video here. See you in another video. Thank you.